Hello, my name is Dan Pollier. I'm from the University of Colorado, and this presentation is entitled Targeting BCL-2 in AML. BCL-2 is a member of the BCL-2 family of proteins, and the job of this family of proteins is to control the process of apoptosis. The job of BCL-2 specifically, the BCL-2 family member within the family of proteins, is to prevent apoptosis. It's an anti-apoptotic protein. And cancer cells, we now know, have dysregulated apoptosis. It was originally felt that if it would be possible to target a protein that prevents apoptosis, you could restore the normal apoptotic function in a cancer cell and thus allow it to properly die. This has led to the interest in developing BCL-2 inhibitors, and there have been a couple of different strategies. The first was through a technique called antisense oligonucleotides, and this had not much success as a general approach and is not really being pursued. The more relevant or successful strategy has been through drugs that we call BH3 mimetics. So there's a class of proteins called BH3 proteins that interact with the pro and anti-apoptotic proteins in a cell to mediate whether a cell goes through apoptosis or not. And it's these BH3 proteins that truly control the process through which a cell decides to go through apoptosis or not. And so by mimicking these BH3 proteins properly, you can facilitate the ability of a cell to go through apoptosis or not. Historically, these have been problematic because they've been relatively non-specific, and there are many BCL-2 proteins, family proteins, and getting specific regulation of one class of those family members has been a challenge. Venetoclax has been an important advance because it is highly specific for just BCL-2, and it ultimately inhibits BCL-2. We've found that this has been quite active in patients with acute myeloid leukemia. There is some synergy with azacitidine in the preclinical world, so preclinical modeling suggested that this could be synergistic. And so a first-in-disease study with single-agent venetoclax in the relapse refractory AML setting showed there was about a 20% complete remission rate. And then this moved into the upfront treatment setting. So there's been considerable experience now, single-arm clinical trials using venetoclax upfront, specifically for AML patients who are over 60 to 65 who are not candidates for intensive chemotherapy. And it's given with a backbone therapy. So with low-dose cytarabine, there's an overall response rate of 61% and a CR/CRI rate of about 50%. When used with a hypomethylator, either azacitidine or decitabine, the overall response rate was about 80%, with a CR/CRI rate that approached 70%. And with this, we've seen long remission durations, progression-free survival, and overall survival. We've seen activity across most biological subsets of AML, and there is a randomized phase 3 study of azacitidine plus venetoclax versus azacitidine that's now accrued. We also think that inhibiting BCL-2 can assist with our ability to target leukemia stem cells. BCL-2, we know, is overexpressed in leukemia stem cell population, and preclinical work suggested that a BCL-2 inhibiting strategy could target the stem cell population. Clinical results have shown deep, durable, and broad responses, and now we have a mechanism, we've identified a mechanism that shows that venetoclax with azacitidine can selectively eradicate the stem cells through decreased oxidative phosphorylation. And the leukemia stem cell population is uniquely sensitive to this metabolic change. With respect to toxicity, there are the expected infectious complications that we have seen with the treatment of venetoclax-based combinations that has been consistent with what would be expected in an AML population. There's been almost no evidence of tumor lysis syndrome, which was of concern based on the CLL experience. In conclusion, venetoclax is a potent and selective BCL-2 inhibitor. There is minimal activity in the relapsed setting, but high activity and well tolerated with backbone therapies for patients with newly diagnosed AML. And there's some evidence that it targets the leukemia stem cell population. What do the results of this study mean for those treating patients within this disease state? Venetoclax as a BCL-2 inhibitor is emerging as one of the most promising therapies for AML patients.